Hi, everybody. Today I will present you my paper, which is COVID-19 detection in X-ray images using image segmentation and machine learning. This study will introduce an innovative method for detecting COVID-19 infections in chest X-ray images using enhanced and powerful image segmentation for the targeted area of the infection in the X-ray images and introducing this part to a machine learning, some machine learning algorithms. Uh, we face some challenge when collecting or in the X-ray images, or this part of these challenges was already exist before, and some of them are we face them when collecting the data. As you know that chest X-ray imaging is a common, safe, and inexpensive method for diagnosing lung diseases. However, manual interpretation can be subjective and time-consuming, especially during the pandemic that was passed away, alhamdulillah. Challenges include variable images quality, subtle early infection signs, and similarities between COVID-19 and other lung conditions. These factors highlight the need for automated diagnostic tools to support radiologists and improve healthcare efficiency. As we mentioned in this paragraph, challenge one was the image quality and the subtle signs and the similar conditions that made it difficult to distinguish between COVID-19 and other lung diseases. Now we collected the images from Jordanian hospitals, categorizing them into COVID-19 infected um, um, X-ray images and normal X-ray images and pneumonia X-ray images. These are the distribution of these collected data from multiple Jordanian hospitals is represented by this graph. As you see there, this is COVID-19, and this is the normal pneumonia, and this is the total number of images. After that, we pre-process the images by resizing and converting them into grayscale, which was necessary for further processing for the segmenter. Then some enhancement on the contrast were applied using Clashy application. Then after that, in order to get more and more images from different sites, we augment these images by random rotation, width shifting, horizontal flipping, and zooming. After that, we employed the CNN unit architecture for a precise lung segmentation. This model, as you see, consists of two main parts, which is called the contracting path and the expansion path. The contracting path starts from the image. Then we have uh, uh, which consists of the contracting for feature extraction and the expansion path recovering the segmentation map size. The contracting path uses 5 blocks, as you see, 5 blocks of convolutional and max pooling layers, while the expansion path uses 4 blocks of up convolutional layers. Feature map are concatenated after that together to get the precise lung. We focus by this process to the exactly on the lung. This is the segmented image. After that, we will introduce this segmented image to uh, different machine learning models exactly, or I can say these four main machine learning models like KNN and decision tree and support vector machine and the neural network. After splitting the data into 17% for training, 20% for validation, and 10% for testing. The models used was KNN, DT, NN, random forest and support vector machine. After applying these machine learning models, we go to study the performance evaluation metrics, which was the accuracy, recall, or sensitivity, F1 score, precision, and accuracy. Remembering that F1 score is the harmonic measure between recall and precision. And this is the equations of uh, this measurement. Accuracy, which represents the overall correctness. Recall, identify the positives, and precision, correct a positive prediction. And the F1 score is balanced measure or the harmonic measure between precision and recall. After getting the results, we apply, before getting the results, we apply the dimensionality reduction method, which is called PCA, Principal Component Analysis, to all of these machine learning, and we apply them without using PCA. Then in the first pass, without using PCA, in the second path with PCA. The PCA will reduce the unrelevant or non-relevant features from the data set. So then check, we introduce these features after removing the irrelevant features to the machine learning models. Then we get the result. After getting the result, we noticed that the top performance was emerged from KNN after applying PCA. It was an accuracy about 0.899, about 90 approximately, and the area under the curve, which measures the stability of the model. Uh, if the data is changed, it was 0.98, and the F1 score, which is the harmonic total between precision and recall, it was near the accuracy, which is a good indicator. And the performance, the PCA impact was clearly appear when applying to KNN and support vector machine. In support vector machine, the result was improved when applying to SVM, uh, uh, and before, as we see from this table, before without PCA, as you see this support vector machine, after applying, you see the result was coming up, which was has a good impact on the results of the support vector machine. The underperforming model was by random forest and the neural network. For feature investigation or improvement, we have to see why. Why random forest shows and the neural network shows less result or less accuracy than others, and how to improve these results, since random forest and the neural network should have more accurate result than this appears in this testing. So the study, in summary, demonstrates the potential of combining advanced image segmentation technique with machine learning for automated COVID-19 detection. In chest X-rays, the proposed approach showed high performance metrics, particularly when using KNN with PCA. Future research will focus on enhancing the model's generalizability across different populations and clinical settings, exploring additional deep learning technique and improving the distinction between similar pulmonary conditions. This approach could lead to more efficient and scalable diagnostic tools, contributing to better patient outcomes in managing the COVID-19 pandemic and future respiratory diseases. So the key achievements was high accuracy in COVID-19 detection using segmentation and machine learning. The idea was in the main achievement was a perfect, accurate, and strong segmenter from this study. And we see that after getting this part or portion from the X-ray image, by this segmenter and feed and extracting the features and applying the PC on these features, we got a result which was very promising, which means that if we feed these segments to a deep learner, a firm deep learner, we can get more and more accuracy, which will be kept for a future direction, then comparing it with our methodology. So, uh, some potential impact was on when using PCA, and uh, we will have by this method we may have more efficient and scalable diagnostic tools for automated diagnostic tools that will not take much time as manual diagnostics. Thank you very much for your listening and hope you all the best always. And thanks for all our colleagues and parties in this conference. And have a nice time. Thank you very much for listening and hope to see you in other conferences, inshallah.